Hi, my name's Adriana, and I'd like to introduce you to Polaris. And this is Hamlet. He is one of my pack of Vassets, and he's the naughty one. He's notoriously known as the naughty one. You'll notice something a little strange about Polaris right off the bat. Polaris has an equivisor on, this ski goggle looking mask, and there's a reason for that. Polaris injured her eye and had a melting corneal ulcer at the beginning of December and had to have surgery and spent 2 weeks in the vet hospital, and now she is on the mend, but she really fought an uphill battle for the last month and is just now beginning turnout again after having been trapped in a stall for a month due to the eye issue. Here's the mission control center in my tack room, and not included would be the coffee pot, but equally essential. So these are just some of the meds that Polaris has been getting for the past 5 weeks now to treat her eye. So here are the multiple pages of discharge instructions, front and back, from when she got let out of the hospital. The catheter valves have to be replaced every day, alcohol swabs to keep everything sterile. She's been on stall rest because of the eye situation, so she needed to be on trazodone because she was losing her mind in the stall. And whenever I do turn her out, I have to give her ACE as well. In addition to that, because of the stall rest, she's on maintenance dose of preventative dose of GastroGuard, and then she was getting rubs from her mask, so she has to be on ointment for that. If it's not one thing, it's another. These things kind of spiral. This is vorconazole, and it's the antifungal that she's on, and then this is the atropine that I mentioned, and then this is ofloxacin, which is the antibiotic drop that she's been on. And then last but not least is this fun serum stuff. So they take her blood and they spin it into this serum, and then you inject it back into the SPL, which is called subpalpebral. It means subpalpebral catheter, SPL. It's an acronym, and I'll show you that in a minute. Okay, so I'm going to show you a little bit more in depth about what's going on with Polaris's eye. So this is after an entire month of treatment for her melting corneal ulcer, and you can see the SPL that I was telling you about, the catheter system that was surgically inserted into her eye. You can see that here, and it's actually seen better days because it was inserted over a month ago. Originally, her mane was braided and the catheter fed all the way down by her wither, and then you would inject the meds through a port at her wither, but it's broken several times, and so now all that's left of it is this little doohickey right here. So like I said, it's on its last legs. There's a little disc at the end of this tube that's inside her eye cavity or her eye socket, so it goes right onto her eyeball. Now, a couple of things. You can see she already has a rub here from the equivisor, and that can't be helped, honestly, but because she has to wear it all the time, the equivisor. But now I put a sleazy over her head to help prevent that. And basically, I'm going to show you how I change the valve here and how I administer some of these medications. Polaris has been getting turned out recently for the first time after over a month of stall rest. And as you can see, she rolled and got this all dirty. But regardless, once a day, we have to replace this valve. So you unscrew the valve, and this is the old yucky valve that we don't want anymore. And then you take a new valve. Polaris has been extremely tolerant about this whole process. I have to say, there was a certain point where we decided we had to put her on some sedatives because she was just at her wit's end, which you can't blame her. She's a baby racehorse, and she went from being turned out 24/7 to getting zero turnout and being in a prison where she got her eye poked every 2 hours around the clock. So anyway, you can't blame her. So you replace the valve, wipe it with alcohol, and then she gets 0.2 cc's of each of the 4 different medications that get inserted into the SPL. So this one is atropine. So you insert it, and then followed by a flush of 0.8 cc's of air. And as you can see, she's not on any sedatives right now, and she's being really, really tolerant of this. Oh, Po.